calling the HHS calendar. We have 6 agendas today. We're gonna call the HHS agenda at 1:01 p.m. First until we see the our CPN chair is here. So we'll call the HHS-CPN agenda at 1 o'clock first. Thereafter, the HHS-JDC deferred decision making at 1:01 p.m. agenda. Third would be the regular 1:01 p.m. HHS agenda. The HHS-HRE agenda thereafter 1:02, HHS agenda at 1:03, and after that, the HHS agenda at 1:05. Okay, we want people to know about the 6 agendas. Right now, I only have the chair of CPN and also a member of HHS with me, and that's Senator Keoho Kalole. This meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business. Your audio will be muted and video disabled until shortly before it is your turn to testify. Each testifier will have 1 minute to testify. Remember, 6 agendas. So please, if you could stand on your written testimony, we have read it. Okay, do not read again, clarify or stand on it, but be prepared to answer questions. If there's a technical glitch during your time to testify, we have to move on to the next person due to time constraints. I will be reading a list of individuals who submitted written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislator's website. You will find a link on the status page for the measure. We appreciate your understanding and remind you that to use your time wisely, that we have your written testimony, and encourage to use your time again wisely, okay? First up, we have and present with me is, of course, the CPN chair. First up on the HHS-CPN agenda, and we have also Senator Fukunaga of CPN present. Relating to general excise tax, HB 1675. First up, we have State Health Planning and Development Agency and support. Dr. Lewin, are you present? Nope. Okay, next up we have DCAB and support. Next we have Gary Suganuma, Department of Taxation and support. Next, we have Scott Groshut. Oh, please.
Sorry for doing that.
Thank you. Please proceed. Elizabeth, I need a list of testifiers. Okay.
Sorry, Garrison Kurth with DOTAX. We stand on our testimony and comments as written. I just wanted to give you the impact figures for this, the fiscal impact.
And so how much is that?
Expected revenue loss, we're looking at minus 13.3 million in 2026. 32.8 in 2027, 33.7 in 2028, 34.8 in 2029, and 35.8 in 2030. That's all. I'll be available for questions.
Yes, please be present. Thank you. Next up, County of Hawaii Office of the Mayor and support. County of Maui County Council and support. Hawaii Association of Health Plans and support. Rachel Wilkinson.
Thank you, Chair. Support.
Next up, Havana Health and Support. Are you present of HHS-CPN? Please proceed. You have 1 minute.
Okay. Hi, my name is Asha Cannon. I represent Havana Health, which is an independent geriatric medicine practice on Kauai. I see older adults in their homes. In addition to my written testimony, I just want to mention that I still teach because I trained at the University of Hawaii Geriatric Medicine program. I still teach there. And there's a lot of amazing people that we talk to there, and they're all wondering every day if they're going to do primary care or do a geriatric specialist. And a lot of the health systems do encourage them to do primary care because that's what they need. However, sort of like any other specialist, it's really useful, and one specialist can really support a lot of different people, especially in geriatrics, a lot of different PCPs. So this is one of the things that has come up recently, that when I talked to them in the geriatric program about how when they just decide if they're going to go off and do one of the new fun geriatric care models that they are studying, for example, myself, which I chose to do in the home on Kauai just in the last year or two. And they say, but we're going to be taxed more if we're not a primary care provider. just something else in addition to my written testimony.
Thank you very much.
Thank you.
Next, we have Scott Grosset. I think I already called him Hawaii Provider Shortage Crisis Task Force on Zoom. Dr. Grosset, are you present? Okay, you have
Consent
one.
For repeatedly passed, right, GETO bills unanimously in the past. So basically, I'm just going to urge the senators to please consider making this bill as broad as possible. We've got a severe limitation of all kinds of providers. Physician assistants are a big part of our primary care workforce. Most of the missing workforce is specialists. We're in a position, especially in Hilo, where I think a lot of our cancer screening programs for colon cancer, for breast cancer, for a lot of other things are at jeopardy. We continue to lose specialists. And I guess it's almost easier to say which providers should we exclude from the bill. And I guess it would be those healthcare services we no longer want to see available in our community, because this affects almost everyone. And thank you for hearing the bill again. Thanks.
Okay, thank you very much. Next, we have Jerry Creekmore, Hawaii Association of Professional Nurses in support. Colleen Inouye, Hawaii Independent Physicians Association in support. Kohala Coast Urgent Care, Molokai Family and Urgent Care in support. UH in support. East Hawaii IPA, doing business as Big Island Docs in support. Hawaii ACOG in support. Grassroots Institute of Hawaii in support. Hawaii Psychological Association in support. Hawaii Honolulu Neuroscience Clinic in support. Ahahui Ona Kauka, Association of Native Hawaiian Physicians in support. Philippine Medical Association of Hawaii in support. Oahu Pain Care in support. Waiau Therapy LLC in support. One Impact Hawaii in support. Malama Pono Autism Centers in support. Joyful Living in support. We've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 various physicians and their clinics all in support. Hawaii Speech Language Hearing Association. Christina Fuentes, are you present?
Yes, I would like to add to our testimony. I did see that you have lots of testimonies requesting the amendment to add their special services. And just one thing I want to make sure everyone may or may not know, CMS does a cost fix on the physician fee schedule. So where reimbursements for specialties get increased, others get decreased. And over the past 3 years, we've had a 3.4% decrease from our specialty codes. And I know that we want to keep our physicians, we need the providers here, but we can't even keep our private clinics open because in addition to our reimbursement rate cut, we also have to pay the GET tax 100% on our income. So it's another reducing our revenue of 4.7%. And we just can't keep our doors open. We've got wait lists for speech services over 5 months right now for pediatrics and for adults suffering from strokes, feeding disorders, and speech disorders. So I know we've got lots of providers that want to be added to the bill, but I think that we really need to consider adding some providers who are having these reimbursement cuts where we can't keep our doors open, not just to pay our staff.
Okay, thank you very much.
Thank you.
Next, we have Tom Yamachika, Tax Foundation of Hawaii, providing comments. Please proceed.
Thank you, Chairs, Vice Chairs, members of the committees. Tom Yamachika from Tax Foundation. In addition to a written testimony, I wanted to call attention to the definition being put forward by the Department of Taxation. And in its testimony, my comment on that is it looks a little bit too narrow in that, certain specialists can have primary care patients, like a flight or two of them. And they can like do a specialty practice and have some primary care patients, which this definition appears to exclude. So I wanted to see if that definition could be adjusted to take care of that type of situation into account. Then I think that would be a much better bill.
Okay, thank you
We
very
have
much.
to answer questions.
Okay, thank you very much. Next, we have Christopher West, LMHC LLC, Cassandra Fisher on Zoom. Are you there? Please proceed. You have 1 minute.
Yes, I am here. Aloha, Senators. I'm speaking today to bring to your attention important points regarding HB 1675. In the introduction to the bill, it still states that medical providers can recoup the cost of general excise tax from patients. This information has been corrected in testimonies across the hearings of this bill, yet it has not been amended. All medical providers that accept TRICARE, Kaiser, Medicaid, and Medicare are contractually forbidden from passing this cost on to patients. GET tax is one piece of a large and systemically inadequate reimbursement system that our state actually can control. Some things like Hawaii reimbursement rates being 50%, those of Alaska, or 70%, those of California, despite our cost of living being higher, is something that you do not control. However, the 4.7% of additional taxes charged in the state is something you do have control over. I'm asking you to amend HB 1675 to include all state licensed allied health professionals. Amending the bill is a win-win. The tax department has stated that defining primary care is part of the difficulty.
Thank you very much. Next up, we have Rachel Ebert. Esther Smith, are you present? Please proceed. Okay, I see Kelly Whitty. Let's go.
Hello,
ahead.
hey,
Kelly
this is
Whitty.
Esther Smith. Hi.
Okay, Dr. Smith. Why don't we have Dr. Smith first, then Kelly Whitty? Dr. Smith, please proceed. You have 1 minute.
Hello, this is the last time will be speaking to you and defending primary private care, because I am going to be starting a nonprofit, Mohala Health, because it is impossible to stay open as a private practice in Hawaii. Last year, there were measures that you thought would help us and none of them did. Loan repayment does not apply to private practice. It only applies to the large nonprofits such as Queens, etc., who are giant organizations. Payment transformation, which applies to 70% of primary care providers, did not increase their fees from Medicaid to Medicare levels and barely covered the increase in inflation. Lastly, the interstate compact makes it just as easy for us to work on the mainland as it would to bring people in. None of those things help, as is demonstrated by the fact that we lost 5 doctors on Big Island while we gained in population. Oahu did gain 83 providers while losing population. This is a rural health crisis.
Thank you very much, Dr. Smith. Kelly Whitty, you have 1 minute. Please proceed.
Aloha. Thank you for hearing this bill. I will stand on my testimony, but I just wanted to point out that the 13 to 35 million that the tax figures that were given to you are actually dollars taken out of the hands of our healthcare workforce. So the fact that it's going to cost 13 to 35 million helps us understand why we are losing physicians and healthcare workers. We actually have a shortage of almost 800 physicians and 3,500 healthcare workers total. And that money is less that they make compared to the mainland, where we are already low, as mentioned, currently. So anyway, please let them keep that money and don't tax them double. Thanks.
Okay, thank you very much. We have 77 other individuals in support. Christine Park providing comments, Rachel Ebert providing comments, Rami Donahoe in opposition. Anybody else present who wish to testify on HB 1675? Okay, come on up, identify yourself. You have 1 minute. Remember, we have 6 agendas.
Aloha. Good afternoon, Jamie Detweiler, President, Hawaii Federation of Republican Women. I stand in strong support of HB 1675. I stand on the testimony that I submitted, but I want to bring to you today 2 critical important points already touched upon. This has a direct impact on providers. I'm a healthcare administrator retiree, over 30 years in healthcare. It also impacts access to care for patients. And as previously described, the services on the neighbor islands are critical. And I share with you today anecdotal evidence. My mom gave me permission to use her case as an example. She was referred for endocrine services in January of this year and cannot get an appointment till the end of June. And so that's just one snapshot of a person's personal journey, but I urge you to support HB 1675. Mahalo.
Okay, thank you very much. Okay, I see Dr. Lewin finally here. For Shipta, would you like to proceed for Shipta or stand on your written testimony?
I'll stand on my written testimony. Thank you. I apologize for being late.
That's fine. Okay, next we have Kiani. Are you on Zoom? Kiani, and identify yourself, 1675, please proceed.
Aloha, Chair, Vice Chair, members of the committee. I'm Maui County Councilmember Kiani Rollins Fernandez, Kupa Aina of Molokai, standing in strong support of this bill on my written testimony. Mahalo, Chair.
Okay, thank you very much. Anybody else wishing to testify on HB 1675? Any questions, members? So I have one. Bill tax. Either one. I see also Director Suganuma present. And you may not be prepared for this, but last year we passed the GET tax exemption, passed the Senate, went to the House, which I think has the highest probability of passing, which exempts GET tax for TRICARE, Medicare, and Medicaid. Those are the three services that cannot pass on the GET tax, and it's across the board. Do you know how much the tax implication is for when we limit the services to those three services?
I do not today, no.
Will you be able to be prepared for that when it gets to
I
WHAM?
believe we can come up with those.
Because I
figures.
believe that's going to be less than a 39 million or so that you testified to. It's okay. Okay, thank you very much. Any other questions? Okay, seeing none, moving on. HB 2544. First up, excuse me. Relating to medical transportation. First up, we have Director of Human Services providing comments. Next, we have Kiani Rollins. Are you present in support, Kiani? Please proceed.
Aloha, chairs, vice chairs, committee members. Mahalo again for this opportunity to testify in strong support of this bill as well. Again, as a kupaina of Molokai, this is important to my community. I urge you to pass it out today. Mahalo.
Okay, thank you very much. Next, we have Department of Health providing late testimony in support and basically stating a $2 million general fund appropriation, which is already inserted in HB 1800 HD1. Next, anything else to add, Department of Health? I see Lauren Kim. Okay, thank you very much. Next, we have HMSA in support. Thank you very much. Next, we have, I see Kimberly Svetin of Molokai Drugs Inc. in support. Please proceed.
Good afternoon, chairs and vice chairs and members of the committees. I stand by my written testimony, and if there's any questions, I'm available to answer them. Thank you.
Okay, thank you very much. Next, we have those who have registered to testify. Zantel Lindo in support. Zantel, are you present? Next, we have 2544. Austin Johansson in support. Are you present, Austin? Please proceed.
Aloha, Chair, Vice Chairs, Austin Johnson testifying in support of this measure. I'm also the, I stand on my written testimony. I'm also a former command pilot for Angel Flight West, and I'm currently the general manager for Kamaka Air. If there's any air transportation related questions, I'm happy to answer.
Okay, thank you very much. Nobody else having registered testify, so I'm going to read a list of written testimony, and that is Kapono Chong Hansen of Ahahui Ona Kauka Association of Native Hawaiian Physicians in support, Hawaii Pacific Health in support, Queens Health System in support, Indivisible Hawaii Healthcare Team in support, Aloha Care in support, Hawaii Health Systems Corporation in support. 7 other individuals in a support, and Richard Andrew Eckert in opposition. Anybody else wishing to testify on 2544 relating to medical transport? Okay, members, any questions? Okay, seeing none, moving on. HB 2443 relating to medical cannabis. First up, we have Department of Health in support.
Hello, Chair, Vice Chairs, Kyle Brandt with Office of Medical Cannabis Control and Regulation. We stand on a written testimony in support. Available for questions.
Okay, thank you very much. Next, we have Attorney General. I see Andrew Goff providing comments. And we have read your written testimony.
Well, Chair, members, Andrew Goff, for the Department of Attorney General. Just briefly, my department recognizes the need for reasonable limitations to patient home grows. The current law allows a patient to grow their own cannabis. If they cannot, a caregiver can grow for them. The law does not allow a grow site or caregiver to grow cannabis for multiple patients. Not limiting grows risks a grow site becoming a commercial operation, growing large amounts of cannabis and distributing to patients with no license and no requirement that the cannabis be tested for patient safety or tracked to ensure that the cannabis does not get diverted to the illicit market. This would leave the medical cannabis program and patients vulnerable to exploitation and would be antithetical to an orderly transition to a legal market or expansion of the medical program. I'll be available for any questions you have. Thank you.
Okay, thank you very much. Next, we have Hawaii Patients Union, Brent Norris in opposition. Brent, are you present on Zoom?
They're not present on Zoom, Chair.
Okay, next we have Pakaloha Care Clinic in opposition. Are you present on Zoom, Amir Dash?
They're also not present on Zoom.
Okay, next we have Jason Hanley, Care Wailua Medical Cannabis Farm in opposition. Aloha, you have 1 minute.
1 minute. Aloha, legislators. I just want to go through a little role play here to show you how important these medical cannabis sites are. There's about 10 or 15 people in this room right now. And I just want you guys to grasp the concept of multi-card sites thoroughly and the ramifications that this bill will cause if not appropriately amended. Let's pretend all of you here have a medical cannabis card holder and suffer from severe pain and have made Care Wailua your grow site for the last 5 years. If this bill were to pass as is, 50% of you would lose your access to medicine that you've been growing for 5 years. For both these reasons, we're asking the legislator at a minimum to extend the sunshine date to 2026 on this bill and let the DOH figure this out. If you want to pass this now, we ask you to amend this bill and have no limit on multi-cards and no limit on caregivers. A qualifying patient that's handicapped and cannot grow, they need a caregiver, but they're hard to find. And so why not allow one person to care for many? There's no data on the illicit market diversion of cannabis from these sites. It's not happening. We're testing our medicine. We're doing everything we're supposed to do, even above and beyond dispensaries and not even regulated. So we're asking you guys to please look at this bill really closely. It's already in statute.
Okay, thank you
It's about
very
to
much,
pass, so
Jason.
please, thank you. Aloha.
Okay, next we have Sam De La Paz, Green Wave Advisors LLC on Zoom. Sam, are you present?
They're not present on Zoom, Chair.
Okay, next we have Clifton Otto, Akamai Cannabis Consulting, providing comments. Are you present, Dr. Otto? Please,
yes.
1 minute.
Aloha, chairs, vice chairs, members of the committees, Dr. Clifton Otto. You have my written testimony providing comments. I just wanted to highlight that it is very important for patients to be able to grow their own cannabis. I think we can all agree on that. But it's very difficult for patients to grow in residential neighborhoods, very difficult for them to grow by themselves. And so there was a suggestion from the patient community about maybe allowing patients to grow together in numbers based on need on agriculturally zoned land. And so I've offered language to this effect. Thank you for considering this, and I'll be available for any questions.
Okay, thank you very much. No one else having registered to testify, so I'm going to read a list of written testimony. Cannabis Society of Hawaii in support. Michael Cohen, LCSW in opposition. Aloha Green Apothecary providing comments. Mike Galoya Sr. in support. Richard Eckert in support. I'm sorry, there are a number of people who have registered. Let's proceed with those. Kabika Kahiopo, are you in opposition? Are you present, Kabika? Okay, seeing not here. Carl Michael Kavalvik in opposition. Are you present? Carl?
Yes, ma'am. I am here.
Okay, please proceed. You have 1 minute.
Aloha, legislators. My name is Carl Kwalvik, and I've been using medical cannabis in Hawaii for 8 years. I oppose HB 2443, and in addition to my written testimony, I have to say this. If Hawaii limits cooperative farms to 5 cards or 50 plants per site, it would stifle the cultivation of medical cannabis in Hawaii. As an alternative, Oahu Cannabis Farms Alliance proposes grow sites to be limited by space, 5,000 square feet, as this would be an ideal alternative solution. Hawaiians have been growing and using medical cannabis in accordance with state law for 24 years, thanks to former Governor Benjamin Cayetano. Please consider that the laws should be written for the people, not against the people. Thank you for your time. I'm available if you have any questions.
Okay, thank you very much. Next, we have Quentin Wilcox. Quentin, are you present on Zoom?
They're not present on Zoom, Chair.
Jay Wolfberg, are you present or not in opposition on Zoom?
They're
Jay-
also not present on Zoom.
Laura Blue in opposition, are you present on Zoom?
Yes, they're
Yes, I am.
here on Zoom.
Okay, please proceed. You have 1 minute.
Okay, thank you very much for allowing me to testify today. I do stand on my written testimony, but I would like to emphasize that please do not limit caregivers to patients. One caregiver can care for many in these kind of circumstances when they're specifically procuring the medical marijuana for the patient. They're not doing daycare care as we think of in healthcare, where they're washing the patient, drying the patient. They may be doing that, but in the most part of what I've had experience with as a psychiatric nurse practitioner providing access to 329 cards for patients, it's somebody that's simply picking up for them their medication. Please do not limit the amount of caregivers per patient. That's my request.
Okay, thank you very much. Okay, we have 47 other individuals in opposition, 3 other individuals providing comments. Anybody else wishing to testify on HB 2443? Members, any questions? Okay, thank you very much. We're going to move on then. HB 1624 regarding, oh, I'm sorry. Next one is CPN is lead.
That's right. So we'll move to HB 1830 HD2 relating to mental health. This measure establishes provisional or associate level licensure requirements for marriage and family therapists, mental health counselors, and psychologists, and authorizes insurance reimbursement in certain circumstances. First up, DCCA, Professional Vocational Licensing Office with comments. Good afternoon.
Hi. My name is Rochelle Araki, the Executive Officer for the Department of Commerce and Consumer Affairs. We stand on our written testimony providing comments. Thank you.
Thank you very much. Board of Psychology with comments. Office of Wellness and Resilience in support. Oh, yes.
Good afternoon, Chair and members. My name is Christopher Fernandez, Executive Officer, here to stand on the Board of Psychology's testimony offering comments.
Thank you. Office of Wellness and Resilience in support.
Aloha, Chair, Vice Chair, members of the committee. Tia Hartsock, Executive Director, Office of Wellness and Resilience, standing in strong support of this bill, just highlighting the immense need that we're seeing across the state, specifically with the impact of the Maui wildfires, being able to be nimble and respond with mental health support above and beyond what the state provides. Looking at private practitioners to provide provisional licensure is extremely important at this point. Thank you so much.
Thank you very much. HMSA offering comments. Thank you for standing on your testimony. Aloha Care in support. Thank you very much. Halen Dennison in support. Good afternoon.
Aloha Chair members, I'm a lifelong resident of Oahu, licensed clinical social worker and the founder of Spill the Tea Cafe, a youth-focused mental health clinic. Today I share firsthand lived experience regarding Hawaii's significant shortage of mental health providers and the youth suicide crisis in Hawaii. This bill stands more than legislation, it's a crucial lifeline. Suicide is the leading cause of death for Hawaii's youth aged 15 to 24 from SAMHSA. The need for action is never more apparent than today. In addition to that, my deep commitment and a $200,000 debt for my MSW is now also amplified by having to pay $150 for 3 years, all while getting paid less than $50,000. The hardest part about being a social worker is trying to fulfill my calling while having these impossible financial strains on social workers. Thank you.
Thank you very much. That's all the registered testimony we have on this measure. Is there anyone else who would like to testify? Okay, please come up. Whoever wants to come up, just take a seat and then identify yourself thereafter. We might have you in registered as providing written testimony and maybe not live, so just come up and have a seat. Yeah. Go ahead.
Good afternoon, Senators. I'm Alex Lichten, representing the Hawaii Psychological Association. I am very worried that the bill as currently written removes the exemption from licensure for the people that have finished their degrees and need to complete supervised hours to get their full licensure. While they are waiting for DCCA to complete their application, they are not able to work unless that exemption is changed. All training for most mental health professionals in Hawaii would come to a complete standstill. That's unacceptable to the public. That is opposite the intent of this bill. This would actually make the provider shortage worse, not better, unless the exemption is put back in. We're also recommending that this be paid for out of compliance resolution funds. I'm very worried that with the general fund appropriation needed, that this bill could be killed in the Finance or Ways and Means committees, which is essentially what happened last year. We've been working hard for 3 years on this. Thank you.
Thank you. Go ahead, and if anyone else would like to testify, just come up and take a seat. So I know that we got it. Well, you don't have to change seat.
Okay, sorry. Aloha, Senators. Thank you again for hearing this bill. This is the third year that we've seen this measure. And although it's a part of the House Majority Package, actually it originated in the Senate with SB 2829, I believe, in 2022. I just want this committee to be aware that there are 5 state agencies that have testified in support. I think it's a strong testament to the benefit it will do to public health, safety, and welfare. I want to echo what the Hawaii Psychological Association explained in terms of exemptions. Our testimony provides a couple of alternatives to approach that. As a drafting matter, perhaps you could ask for a prepay for an exemption until they get the provisional license. I also want to note that there is a statute that says the DCCA can issue conditional licenses, and so we think that this functions exactly like that. Finally, I just want to stress that we do believe the CRF is the, if I may just borrow a few seconds for one of my two other clients.
I'm sorry, we got to keep moving.
Okay,
Thank you very
CRF
much.
funding, thank you so much.
Is anyone else interested in testifying on this? Okay, members' questions. Okay, we'll move on to the next CPN lead measure, which is HB 2553 HD2 relating to pharmacists. This authorizes pharmacists to administer vaccines to persons 3 years of age or older. Board of Pharmacy and Support. Do we have the Board of Pharmacy? Good afternoon.
Good afternoon, chairs and members of the committee. James Gizuski, Executive Officer for the Board of Pharmacy. So we stand in our written testimony in support. There was an amendment requested in our testimony that the language in the bill is consistent with the PrEP Act and that all pharmacy technicians are nationally certified. So I'll be here for any questions. Thank you.
Thank you. University of Hawaii, followed by the Department of Health. So if you're here, then just come sit up. Do we have University of Hawaii? Go ahead.
Yes, I'm here, Ray Matsumoto, Dean of the Daniel K. Inouye College of Pharmacy at the University of Hawaii Hilo. Stand on our written testimony in support of this and will be available for questions if you have any. Thank you.
Thank you very much, Department of Health.
Department of Health stands on its written testimony and will answer any questions if there's any.
Thank you very much. And next we have CVS Health and Support, followed by Walgreens.
Annie Makapagawa on behalf of CVS Health will stand on our written testimony and support and available for questions.
Okay, thank you very much. Molokai Drugs and Support.
Hi, good afternoon. My name is Kimberly Svetten, and I'm the president of Molokai Drugs. I'm actually standing in the immunization room we built 3 years ago during the pandemic. So we were able to immunize hundreds of people on the island of Molokai with COVID shots, flu shots, pneumonia shots in a private setting. You're not in the hallways or the aisles of a store. And so I'm standing by my written testimony, but want to add that this bill will help with health access on the neighbor islands, especially rural communities like Molokai. Thank you.
Thank you very much. Hawaii Pharmacists Association in support.
Good afternoon, chairs, vice chairs, member of the committee. Corey Sanders, president of the Hawaii Pharmacists Association. Will stand on our written testimony in support. We are okay with the amendment that was given by the Board of Pharmacy. And I do want to put an emphasis on one of the amendments that I had is maybe standardizing the language to 3 and older instead of 3 to 17. So there's not some inconsistencies in breaking up 3 and 17 and 18 and older.
Thank you.
Thank you.
That's all the registered testimony we have on this measure by individuals who indicated they would be present. Is there anyone else who would like to testify?
Apologies, Chair. You called us, but then I didn't want to interrupt because you kept going. Mihoko Ito on behalf of Walgreens, we'll stand on our testimony and support. Thank you very much.
Thank you very much. Is there anyone else who would like to testify? Okay, I'd like to note that we received 20 pieces of testimony in support for this measure and 1 in opposition. And actually on the prior measure, I did not indicate on HB 1830 HD2, we received 65 pieces of testimony in support, 0 in opposition and 3 with comments. So on the current measure, HB 2553 HD2, are there any questions, members? All right, seeing none, I'll yield to the health chair.
Okay, thank you very much. So moving on to HB 1624 relating to insurance. First up, I saw Gordonito here, Insurance Division, providing comments.
Good afternoon, Chair.
Thank you very much. Next, Fertility Institute of Hawaii in support. Are you present, Emily Goulet?
I am present. My name is Emily Goulet. I am an MD specializing in infertility care, standing in strong support of this bill. Beating and surviving cancer is often at the cost of giving up one's dreams of having biological children. Survivorship should mean living out one's dreams of having a family. Our healthcare system offers a twisted deal. It will help you beat the cancer, but at the cost of giving up your ability to have a child. We have the medical ability to preserve the basic human right of the ability to reproduce, but the costs are prohibitive, requiring most individuals to come up with thousands of dollars to complete the treatment for fertility preservation before cancer treatment starts. Thank you so much for your consideration in support of this bill.
Okay, thank you very much. Next, we have American Cancer Society Cancer Action Network in support. Cynthia Au, are you present?
Yes. Chairs, vice chairs, and committee members, thank you for the opportunity to support this measure. Cynthia Au on behalf of the American Cancer Society Cancer Action Network. We stand on our written testimony, but I just wanted to say that when cancer patients between the ages of 20 to 39 is given their diagnoses that they might have cancer, they're also given the have a talking to about whether or not they would want to have fertility preservation at the same time. So on top of just finding out that you might have a disease, but also finding out that you might have to think about how to, if you want to have family planning, that might be very, very a mental health issue that could happen with our patients and who might be going through cancer. So please consider supporting this bill, and we thank you for the opportunity to testify.
Okay, thank you very much. Next, we have Hawaii Association of Health Plans providing comments. Rachel Wilkinson. Thank you very much. Next, we have HMSA providing comments. Thank you. Next, we have Kaiser Permanente, John Kuramitsu providing comments.
Good morning, Chair. Kaiser Stanzas, brief testimony of the comments.
Okay, thank you very much. Next, we have Andrea Otto in support. Andrea, are you present?
Hi, present. Aloha, chairs, vice chairs, members of the committee. Thank you so much for allowing me to submit testimony on this bill. I am a young breast cancer survivor. I was diagnosed in October of 2022. I continue to go through cancer treatment, and I am someone who would be directly impacted by this bill. I lost my fertility and my dreams of having a baby with my husband because of my diagnosis, and a bill like this would allow fertility to be a more realistic possibility after completing treatment and receiving approval from my oncologist after my treatments are complete. I highly urge you to consider this bill. Roughly 80,000 Americans between the ages of 20 and 39 are diagnosed with cancer each year, and 1 in 8 women are diagnosed with breast cancer. So the fact that so many of us have our fertility impacted is something that this bill would greatly address. Thank you very much, and I'm available for any questions.
Okay, thank you very much. No one else having registered to testify. Those providing written testimony are Hawaii Society of Clinical Oncology Association for Clinical Oncology and Support, Hawaii Society of Clinical Oncology, Charles Miller and support, the Leukemia and Lymphoma Society and support, Fertility Institute of Hawaii and support, and Jennifer Liu in support. Anybody else wishing to testify on HB 1624? I see Jennifer Liu, please proceed.
Hi, thank you. Aloha Chair, committee chairs, vice chairs, and committee members. Thank you for allowing me to testify. I stand by my testimony, and I just wanted to share that I had hopes of starting a family. However, when I was diagnosed with cancer, due to the fact that I was thinking my life was at risk, I just want to emphasize that my choice to, think about doing IVF, whatever, wasn't even on my mind because I was fighting for my life, and it directly impacted me as I chose not to do anything about fertility and just forgo that chance of having a family because I was worried about my life, and making the decision about all of this was very stressful. And I think that if you guys could support this, it would really help people that are in positions like mine so that they could one day have a family and they would not be put in a situation where they have to just forgo their future completely, thinking about only of the present day of just making sure that they're alive. Thank you.
Okay, thank you very much. Anybody else wishing to testify on HB 1624? Members, any questions? Okay, CPN Chair, do we need to recess for decision making? Okay, we're gonna recess for decision making. We have HHS quorum, just want to let you know. Okay, we'll recess for decision making. Recalling the 1 o'clock agenda, HHS-CPN calendar. Oh, good. We have quorum on both sides. Thank you. For HB 1675, Chair's recommendation is to pass with amendments. We are going to, as stated during the testimony, delete the content and insert the language that we have passed in 2023 of SD 1035 SD2. We're going to add a defect date. I believe that's the highest probability in this fiscally conservative times of passage. I really want to give as much relief to the care providers, especially those services for Medicare, Medicaid, and TRICARE, and that's the reason why I'm doing this. Okay, any comments, questions, concerns? Pass with amendments. Seeing none, Vice Chair for the vote.
Okay, House Bill 1675, House Draft 1, recommendation of the chairs to pass with amendments. Chair votes aye, Vice Chair votes aye. Senator Keokolole? Aye. Chair Shimbakuro is excused. Senator Awa? Aye. Recommendation is adopted, Chair.
CPN, same recommendation. Chair votes aye.
Thank you. Vice Chair also votes aye. Senator McKelvey is excused. Senator Richards?
Aye.
Senator Awa?
Aye.
Your recommendation is adopted.
So for HB 2544, Chair's recommendation is to pass with amendments. We're gonna just put in a different defective date of December 31, 2050. We're gonna note in the committee report, Department of Health's testimony that $2 million is already in the HB 1800 budget for this measure. Any comments, questions, concerns? Seeing none, Vice Chair for the vote. Chair votes aye.
Okay, 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
CPN.
CPN, same. Thank you. Same recommendation. Chair votes aye.
Thank you. For the members present, are there any voting with reservations or objections? Hearing none, your recommendation is adopted.
So for HB 2443, I really want to thank the testifiers in in their testimony. And I'm gonna be passing it with Department of Health's proposed amendments for 10 patients per grow site, so we're doubling it. So we are taking into account everybody's testimony. We're gonna add an effective date of upon approval of, the effective date of December 31, 2050 to continue further conversation. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, House Bill 2443, House Draft 2. Again, recommendation is to pass with amendments. 4 members are present. Any reservations? Any noes?
No.
No vote for Senator Arwa. Recommendation is adopted.
CPN, same recommendation. Chair votes aye.
Thank you. Of the CPN members present, are there any voting with reservations or objections other than Senator Awa? Hearing no further objections, your recommendation is adopted.
Thank you very much. Next measure, HB 1830 HD2 relating to mental health. The recommendations are to adopt the proposed amendments offered by the DCCA Division of Professional Vocational Licensing and the Board of Psychology amendments, except the request for general funds. And I'd just like to acknowledge there are many moving pieces on this measure, but it is also the last vehicle moving, and we would like to keep the conversation going. So those are the proposed changes. Any discussion? Seeing none, Vice Chair, passing with amendments. Chair votes aye.
Thank you. Of the CPN members present, are there any voting with reservations or objections? Hearing none, your recommendation is adopted.
Thank you.
So for HHS, same recommendation, Vice Chair for the vote, Chair votes aye.
Okay, thank you very much, Chair. 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Thank you very much. The next measure is HB 2553 HD2 relating to pharmacists. The recommendation is to pass this measure with amendments. We will adopt the Board of Pharmacy's proposed amendments. Any discussion? Seeing none, Chair votes aye.
Thank you. Of the CPN members present, any objections, reservations? Okay, thank you, Senator Awa. Vice Chair votes aye. Senator Richards,
Aye.
your recommendation is adopted.
Thank you.
Thank you. So for HB 1624, Chair's recommendation is to pass with,
Chair, you have to vote on that one.
sorry. So HHS, same recommendation. Chair votes aye. Vice Chair for the vote for HB 2553.
Thank you very much, Chair. 4 members are present. Any reservations? Any noes?
No.
Okay, recommendation is adopted, Chair.
Okay, thank you very much. So for HB 1624, Chair's recommendation is to pass with amendments. We're gonna accept Kaiser's and Hawaii Health Plan's proposed amendments to exclude certain procedures. We're gonna change the effective date to December 31, 2050. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 4 members are present. Any reservations? Any noes? Recommendation is adopted, Chair.
Okay, so we are adjourned, CPN, sorry.
CPN, same recommendation. Chair votes aye.
Thank you. Of the members present, are there any objections or reservations? Hearing none, your recommendation is adopted.
Thank you.
Okay, thank you very much. So the joint HHS-CPN agenda is adjourned. We're moving on to decision-making only for the HHS deferred decision-making agenda with JDC. Yes. Yes, okay. I just want to make sure we're on. For decision-making only, JDC having already done their decision-making. This is calling on HB 1976. Concurring with Chair Rhodes' recommendation, we are going to pass with amendments. We are going to put in a $10,000 appropriation in the blank, make an effective date of July 1, 2024. That's it. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, pass with amendments.
Okay, House Bill 1976, House Draft 1, recommendation of the Chair is to pass with amendments. Chair votes aye. Vice Chair votes aye. Senator Keokolole.
Aye.
Senator Shimabukuro.
Aye.
Senator Awa.
Aye.
Recommendation is adopted, Chair.
Okay, thank you very much. We are adjourned for the JDC HHS calendar. We are now moving on to the HHS agenda for 101. May I have my 101? Okay, first up, we have HB 2159 HD2 relating to mental health. Okay, first up, we have DECAB in support. Next, we have Department of Attorney General providing comments.
Good afternoon, Chair, Vice Chair, members of the committee. I'm Deputy Attorney General Regina Shimada. The department did submit written testimony offering comments on this measure. The purpose of this bill in its original form was to require the department to assist with the preparation, filing, and representation of petitions for assisted community treatment, or ACT. However, there were several amendments made in HD1 which carried over to HD2 before the committee today. Most of the amendments align with the bill and intent of improving access to ACT, except two sections. Section 9 on pages 9 through 11 amends HRS Chapter 704, Section 404, subsection 2, to make it inapplicable to family court cases unless the presiding judge orders otherwise. The jurisdictional exclusion appears to go beyond the scope of this bill, which again was introduced to require the department to assist with ACTs. Section 11 on page 16 reduces escape in the second degree from a Class C felony to a petty misdemeanor if the offense was committed by a person under the custody of the Director of Health. Changing the category of a criminal offense does appear to go beyond the scope of this bill and triggers the concern for non-germaneness. The department recommends.
Thank you very much. We have read your testimony and you are reading from it, so please try to just stand on it. Thank you. Next up, Institute of Human Services providing support. Connie Mitchell, please proceed.
Thank you, Connie Mitchell, IHS. Just wanted to say that we support this measure, the removal of the appointment of the public defender, as we had stated in our testimony. I just wanted to say that I believe SB 2557 allows the judge to appoint representation if he or she deems necessary. Number two, we support the Attorney General's being involved in petitioning and having them respond to people asking for it. The last thing is that we strongly support requiring individuals displaying symptoms of mental illness that result in emergency transport by police, MH1 or MH2, to be provided emergency evaluation and work with the case manager in the community. That's a really big part that's been missing for a long time. Thank you.
Okay, thank you very much, Connie. Next up, Hawaii Disability Rights Center's Louis Urchuk providing comments.
Yes. Good afternoon, Senator and members. There are some things in this bill that are certainly worthwhile, but the overriding concern that we have is this push to deny legal representation to people who are the subject of these act proceedings. And so a few years ago, the legislature took away the right to counsel. They substituted a guardian ad litem, which is not the same thing. They do not advocate as lawyers for them. So the real concern I have is here, this bill would bring the Attorney General in to represent the petitioner. Formerly, the petitioner was typically like a family member who doesn't know what to do with the relative. So maybe there was no imbalance because nobody had a lawyer. But if you're going to bring the Attorney General in to represent the petitioner and you're not going to have a lawyer for the respondent, these are serious due process violations that I think you need to really be clear about before you decide to do that. These people can be forcibly medicated if they don't comply with the order. I haven't found any state in my limited research that doesn't provide an attorney to these people. So
thank you very much.
Thank you, Senator.
Yeah. Okay. Next up, ACLU in opposition.
Aloha Chair, committee members, Carrie Ann Shirosa on behalf of the ACLU. We oppose part 2 of this measure. We've outlined it in more detail, but plain and simple, we believe the bill as proposed and removing the right to counsel for indigent persons subject to assisted community treatment is unconstitutional. There is no exemption in our Constitution for people who may have mental health disabilities, or co-occurring disorders. And so we ask a couple of possible remedies. One is to defer the bill, or 2, if keep the public defenders representing individuals who are indigent, or 3, guaranteeing the right to court-appointed counsel. Any of those could remedy, and as highlighted, the limited number of states I looked at all provide for legal counsel throughout the act proceeding, and we modeled our bill after Kendra's Law in New York, Laura's Law in California, and it clearly states unequivocally in their statutes, legal counsel throughout all the process.
Okay,
Thank you so
very
much.
Okay, no one else having registered to testify. We have judiciary and support. Next we have State Council of Mental Health and support, Hawaii State Department of Health and support, Hawaii Substance Abuse Coalition and support, Hawaii Psychological Association and support, Ellen Godby Carson in support, Marcia He in support, Charlotte Savage in support, Angelina Valderas in opposition, Raylan Reno Yeomans in opposition. Anybody else wishing to testify on HB 2159? Seeing none, members, any questions? Okay, moving on, HB 2341. First up, we have HB 2341 is relating to funding for the Tobacco Enforcement Special Fund. First up, we have Attorney General in support. Oh, you were the Attorney General now, Casey?
No, this is Rich Stacy.
Oh, yeah, that's right. Okay, sorry.
Good afternoon, Chair, Vice Chair, members of the committee. My name is Rich Stacy. I'm the Deputy Attorney General with the Tobacco Enforcement Unit. The main thing I want to emphasize outside my written testimony is that the rates have gone down. That's why the revenues have gone down, which affects our unit. But our unit isn't based on lack of smoking. So the downward trend of smoking does not affect our duty to enforce the MSA. The MSA money every year Hawaii gets, last year got 40 million. It's over 1.1 billion since the MSA started. Most of the money goes to the rainy day fund, the JABSON, tobacco prevention control, and almost half goes to the general fund. We get a small portion of that, but we're seeking to stabilize our funds. I'm willing to answer any questions, and we appreciate the support and ask that it pass on.
Okay, thank you very much. Next, we have the Department of Health and Support. Thank you very much. Next, we have the Department of Taxation providing comments. Okay, thank you very much, Director. Next, we have Hawaii Public Health Institute in support.
Good afternoon, Chair, Vice Chair, members of the committee, Peggy with Hawaii Public Health Institute. We support the measure because of the important work that the AG's unit does, but also because it's important for the state to continue to receive the full amount of master supplement. Thank you.
Okay, thank you very much. Okay, next we have Tax Foundation of Hawaii. Tom Yamachika, are you present on Zoom?
I am. Thank you, chairs, members of the committee. Tom Yamachika from Tax Foundation. We will send our written testimony, be available for questions.
Okay, moving on. Next, no one else having registered to testify. We have American Cancer Society Cancer Action Network in support, Retail Merchants of Hawaii in opposition, Hawaii Smoker Alliance in opposition, Jessica Chang in opposition. Anybody else wishing to testify on HB 2341? Members, any questions? Seeing none, moving on. HB 2556, relating to Hawaii Able Savings Program. First up, we have Dainty Bartolodis, Council on Developmental Disabilities and Support.
Most to end our testimony, strong support.
Okay, next we have Louis Urchik, Hawaii Disability Rights Center in support.
Thank you, Senator. ABLE is such a great program that when it passed Congress a long time ago, it was like unanimous. Just to give you an idea of how impossible that is, it passed unanimously there. We passed a state law years ago here as enabling legislation. Danger's done a great job, but for years, the Department of Budget and Finance basically didn't implement rules. They were dragging their feet, as you can probably appreciate. And so, but against all those odds, Daintree and Aditi Council have done a fabulous job of trying to do outreach and get this program up and going. And so whatever help you can do in terms of additional staff, additional support would be really good, because it's a no-brainer. And yet we've really dragged in terms of the implementation. So this is a great bill. Thank you.
Thank you very much. Special Education Advisor Council and Support, Susan Rocco, are you present?
They're not present on Zoom, Chair.
Okay, next we have James Langley. I see you. Come on up.
Chair, I will stand on my written testimony in support. Thank you.
Thank you very much, James. Next we have Michelle Moralt in support. Michelle, are you present?
Yes, I am, Chair. Good morning, good afternoon.
Come on up. Why don't you talk in the mic?
Sorry.
It's okay. Thank you for coming. Please proceed.
You're welcome, Chair. Welcome, Chair, and the Chair of the committee. This the testimony. I'm here for that testimony. I stand on my writing testimony support.
Thank you very much,
You're
Michelle.
welcome.
Okay, next we have Ka'ili. Ka'ili, are you present on Zoom? Oh, you're present in person. Okay, please identify yourself, Ka'ili.
My name is Kylie, and I'm a strong supporter of this measure because I have an able account. It helped me save tons of money on my bank. So if you have any question, concern, please let me know. And I hope I give you a business card soon. Yeah.
Okay, terrific. Thank you very much. Anybody else wishing to testify on? Oh, let me read out my written testimony. Okay, we have Ann Kivitsak in support, Janelle Fiesta in support, Robert Webb in support. We also have Kirby Shaw, DCAB in support, Department of Budget and Finance, Luis Oliveira in support, Executive Office on Aging, Caroline Kadirao in support. Anybody else wishing to testify on HB 2556? Seeing none, members, any questions? Okay, are we ready for decision making? Okay, we're moving directly to decision making. First up, for HB 2159, Chair's recommendation is to, and I was there at the time when we removed the public defender's participation, and I just want to make sure both ACLU and I had concerns at that time, but the public defender did not want to defend. That was my memory of their testimony. So we're going to be passing this with amendments. If you notice, the public defender did not testify. Okay, so we're going to pass it with AG's amendments, but we are going to put a defect date to see whether or not we can fix the due process problems, okay? And the defect date is December 31, 2050. Any comments, questions, concerns? Seeing none, Vice Chair would vote pass with amendments. Chair votes aye.
Thank you very much, Chair. House Bill 2159, House Draft 2, recommendation of the chair to pass with amendments. Chair votes aye, Vice Chair votes aye. Senator Keokalole. Aye. Senator Shimabukuro.
Aye.
Senator Awa is excused. Recommendation is adopted.
For HB 2341, it is an anomaly, well, not really an anomaly, that the better we are at suppressing smoking, the less funds there are for all of the things, the good things it funds. We are going to defer HB 2341 in lieu of HB 2504, which we'll be hearing later on in the calendar. So moving on, we're only going to be passing one cigarette tax bill today, and that would be HB 2556, Able Savings Program. I like this program too. Yes, we're going to be passing this with tech amendments. We're going to add a defective date of December 31, 2050. We're going to note in the committee report that there is a blank appropriation that we are going to be requesting the various departments to fill, hopefully by the next committee hearing, so that we could effectively pass this. So any comments, questions, and concerns passed with tech amendments in a defective date? Pass with amendments.
Okay, thank you, Chair. 4 members are present. Any reservations? Any no's? Recommendation is adopted, Chair.
Okay, thank you very much. Okay. Oh, we have HRE present. Thank you. So we're going to be moving on to the HHS-HRE agenda at 1:02 p.m. Thank you. Oh, here, all of this too. Hearing HB 2504 relating to cigarette taxes. First up, we have Department of Health in support. Okay, thank you very much. Next, we have Gary Suganuma, Department of Taxation, providing comments.
The department stands on the testimony offering comments.
Okay, thank you very much. Next, we have American Lung Association in Hawaii in support. Okay, next we have University of Hawaii in support. Next, we have Hawaii Public Health Institute in support. Excuse me, and you are?
I'm the Cancer Center.
Okay, Cancer Center. Okay, we're getting there. Hold on. Oh, I did say UH?
Yes.
Okay, so
I just wanna
UH.
make sure, yes, we support and just, yes.
Okay, UH in support. Okay, nope, and nobody else having registered to testify. We have Hawaii Substance Abuse Coalition providing written support, Hawaii Pacific Health in support, American Cancer Society Cancer Action Network in support, Hawaii Primary Care Association in support, Tax Foundation of Hawaii providing comments, Tax Foundation Adam Hoffer providing comments, Hawaii Smokers Alliance in opposition, Jessica Chang in opposition, Chad Wheeling in opposition, Michael Nakasone in opposition, William Good testifying for Cigar Association of Hawaii in opposition. Anybody else wishing to testify in HB 20, come on up, HB 2504. Please identify yourself.
Afternoon, Chair. My name is Raw Long, owner and operator of our RK Grocery located in downtown Chinatown. I'm here to ask you to oppose HB 2504. Have been operating my business since 2013. I moved here from California with my wife and at the time, 2 kids, but later being blessed with a 3rd child in 2017. My family sold what we had in California and invested everything into this business. We have been part of the Chinatown community for a little over 10 years. Every year, droves of people leave Hawaii, marking 7 straight years of decline. The cost of living here is twice the national average. And now we are talking about another significant increase in tobacco taxes. Not only are you forcing the increase in operating costs of business like myself, but ultimately putting the burden on customers. We just came out of COVID shutdowns, forcing a lot of local business to close their doors and incur debt. According to the National Association of Convenience Stores, tobacco products constitute 30% of our revenue, and directly is close to 40%. This tax increase will hurt our business. They had.
Okay, thank you very much. Okay,
Thank you.
We may have questions, okay? Anybody else wishing to testify in HB 2504? Members, any questions?
Tom Yamachika from Tax Foundation. Thank you for receiving our late testimony. Will be available for questions if you have any.
Okay, thank you very much. Okay, questions?
Yes, thank you. For Cancer Center or UH?
Come on up.
So, basically, what is your income and what sources are you having the income from right now?
Yeah.
You mean the entire cancer center, Senator?
Yes.
So the part is a G fund and there's a T fund, and we also have other.
I'm sorry, how much is from G funds?
I'm gonna have Cliff Martin, who is on a call to provide the exact number. Yeah. He's our Associate Director of Administration.
Hello, I'm Cliff Martin. I'm the Associate Director.
Can't hear you.
Speak into the mic, please.
Can you hear me now?
Barely.
Yell.
Okay, Cliff Martin, Associate Director, Administration, 4.5 million in G funds, about 600,000 in tuition, 3.5 million in RTRF, 22 million in grant funds, 9.5 million in cigarette tax revenue. About
Did you say, I'm sorry, go ahead.
2.5 million from Hawaii Cancer Consortium and about $1 million in philanthropic.
1 million and what?
Philanthropic.
And was it 600,000 from tuition?
Yes.
Yes.
That was last year. Yes.
I thought it was more like 4 million.
No, I think there's a misunderstanding on that amount, maybe confusing that with the RTRF funds, which was 3.5 million.
Well, that's the RTF funds. Okay, and your expenses? How much in salaries? How much in salaries? How much in research? And how much for the debt service?
Debt service is 7 million. I don't have those expense numbers on top of my head right now. We can get that information for you.
So that's all your expenses, just the 7 million in debt?
No, for the operation, we have to need about $14 million for the overall operation is what we need in terms of expenses. And the other expenses is related. I don't have the exact number, but it is a grant funded from different and like NIH type of peer grants.
So 14 million includes the operation and
Yes.
salaries?
The salary is somewhat part counted by staff from part of the 14 million, which my admin could provide. But there is also additional funding from the NIH funding that's associated with that, but supporting the salary.
So what portion of the salaries are from your extramural funding and what portion of the salaries are from general funds?
So that, but we
I
cannot.
can
give-
answer the general fund. General fund is 100% salaries. And
So 100% salaries for all the researchers.
what I'm saying is that 100% of the general funds, it only pays for salaries.
Yeah, but what portion of the salaries are general fund versus your extramural funding? Because across the country, it's usually about 80% of their salaries come from grants, whereas in Hawaii, that's not the case. Right?
So as our Dr. Dr. Simas has expressed in the past, generally my understanding or our understanding is in the range of 50% plus minus for the funding.
I'm sorry?
50%.
50?
50. And that depends on your tenured or not tenured, has a significant impact. So we have a tenure faculty and non-tenure faculty. And for non-tenure faculty, yes, because they have not got what we call the RO1 type of grant. So they are basically funded from, we are supporting them so that they could transition to tenure. And of course, if they cannot get an outside grant, they will be pretty much kind of released from the position. Now, if they get tenured, the grant funding is usually in that for plus minus 50%. I don't have the exact number, but that's in the range that we support them. And then there's other tenure component that's coming from the state.
Okay, well, I passed out the chart that says that majority of is getting far less than 50%. 87.26% is 70.4% tenured is general funds, 71.55% tenured, 85%, that's all general funds.
That depends on how the report is created. I believe that report was created based on principal investigator. So the grants, that's the principal, there's two types, principal investigator versus being co-investigator. And some investigator does not have a principal investigator. So that part of the information is not in that information. So they look like they're getting a lot of G fund when I was looking at it, that was my interpretation.
Well, this was submitted by UH. I didn't make these numbers up. So I'm just saying.
I respectfully agree with you, Senator Kim. Yes.
Because according to the Warburg study, they also say that we are not paying, or our researchers are not being paid like they are on the mainland. In fact, they state here that address funding of faculty costs. And they said that if the UHCC faculty received 80% of their salaries from extramural funding sources, 5 million annually in funding support, or would come from the cigarette tax that could go to compensating and freeing up for other uses such as maintaining the facility, for operating the facility, and so forth. And that's one of the things that Warburg mentioned, or not mentioned, but stated as to what are some of the things that we can do to make sure that the Cancer Center can continually proceed, because they know that the taxes are continuing to decrease because of the lack of smokers.
Right. So in terms of going back again, in terms of our tenured faculty, generally, not just our cancer center, but university, it is not that kind of, I have never seen that 80-90% with other university. That is extremely high, and that is not sustainable from the research investigator perspective. As you probably know, there is a cap on NIH funding. So it's, that means that you have to bring like 5 RO1. RO1 has a cap of total of 500,000.
I'm just stating what is being said across the board, all the studies that UH did according to what we're getting.
I have read this.
Okay. So Doctor, tell me then, how do we intend to maintain our facilities, operations, and research, or even grow them when we are relying on the most regressive excise tax that generates less and less collections from the middle class and the higher income individuals, and that it will continue to dwindle? I mean, according to the Tax Foundation, this tax would disproportionately impact low-income Hawaiians. And according to the U.S. Surgeon General, increasing the price of tobacco products is the single most effective way to reduce consumption. So raising the tax will accelerate the reduction in smoking and therefore the tax. So what is your folks' long-term plan on how we're going to maintain the Cancer Center? Because this tax is temporary.
Yes. I totally agree that this is a temporary measure, and there is a really need for a discussion in the UH Manoa and the Cancer Center to have a fundamental fix. But as I also has proposed, the Early Phase Clinical Research Center, we do like to have a clear-cut revenue a stream from part. I'm not saying this is the only thing. The other is, as you know, that we have a shelf space of close to 2.5 floors or 2.7 floors that needs to have we are in talking with a certain entity that we like to see whether this could be a part of a revenue stream. Yes, I totally agree with what you're talking about. I do not feel comfortable with the situation I got into, but I still remain that this cancer center is very important. It's important for the health system. It's important for improving the healthcare of the entire entity. But I am not going to ignore what you're saying. I feel really responsible over the past 1 year of trying to have a better financial outcome, actually.
I know, Doctor, that you're new and you started, I don't know what, 6 months ago, 7 months ago, 8 months ago?
1 year.
1 year, it's been 1 year.
1 year and two months.
But this issue with the Cancer Center is not new.
No, it's not new.
Back in December of 2014, Hawaii News article, costs outweigh funding revenue. The Cancer Center ended last year with nearly 10 million deficit and is quickly draining its revenues to stay afloat. The Cancer Center has a set of operating and management issues that are much bigger than who the director is, said President Lasner. And then we commissioned, because of this, it was commissioned, the Warburg study was commissioned to deal with these issues. So what have been instituted from the Warburg study? What recommendations did they make? That was instituted? Like one of them was funding the research faculty costs. The other one was to combine or to not do a clinical trials. And then there were 2 studies that said that we should combine the cancer center and the medical school.
Right.
And none of those things have been adopted. So I'm just saying,
So I
what is
don't, one
UH's
thing
long-term
that's,
plan?
one thing is, what is the ultimate outcome people are looking for? I think we all could agree that we would like to
Hold
have
on.
a, may I finish?
No,
No,
I'm sorry.
okay.
The question is, what is the plan? Not what the outcome, not what people would want, but what is the financial plan on how we're going to make sure that the cancer center is maintained and is operational and is doing what we wanted it to do?
As I mentioned, that this fundamental fix is need to be discussed with the UH Manoa
Yes.
clearly.
Yes, and I'm saying that.
And
this-
I am not gonna say what is the solution, but I could say that I am stating, as you
Yes.
mentioned, that there is a need.
Yes,
And
but what I'm saying is that this need has been identified for over 12 years ago. Over 12 years ago, and we're at this stage. And while we're asking for a 2 cents tax increase, that is going to dwindle. So we're going to be right back where we are in what, 5 years?
at the same time, I am also working on the early phase for budget
But
and
that's not going to
also,
bring in any money. And the Warburg study said we shouldn't embark on that, and that's what worries me.
well, there are many advanced patient
Okay,
who
we're not here
has,
to argue the early clinical trials at this point.
Hmm?
We're not here to argue the early clinical trials because we clearly have a difference
Right.
of opinion.
Well, I think once again, it's the building and the early phase and how we effectively administrator run the management.
Okay, I give up at this point. So anyone else has questions?
Yes, I do.
Yes.
So
go
thank
ahead.
you. Director Suganuma, do you know how much revenue is right now going to be, well, projected if we just increase the base of the 2 cents to electronic smoking devices and e-liquids?
I don't.
No, okay.
Yeah, the reason is, as you know, the vape products are now being taxed at 70% of wholesale. We're first getting data because the tax only went into effect in January. So we have some numbers for January and partially for February. But we don't believe that it's a sufficient amount of data to make any kind of
Okay, so last
reliable
year,
projection.
last year when we passed the 70% tax on vape products and electronic smoking devices, I believe your projection was 12 to $15 million. I believe it was $15 million per year if we passed 70% and 12 million if we passed the 50%. Based upon those projections, could you have reverse engineered how many vape products or e-liquids we are projected to be selling to generate that much money?
Yeah, that was part of last year's revenue impact. And I think I have it with me. You want me to?
Yeah, why don't you tell me? And that way we can just multiply it.
I apologize. I don't have it written, but I have the email.
Yes. Because we know from prior testimony that they want to be able to generate as much as $9.5 million on cigarette taxes. And they don't expect to make that with the decreased use of cigarettes. But if we broaden the base,
Yes,
Okay, you know what? Why don't you give us written testimony by the, it has to go to WAM anyway.
Yeah.
Okay?
Yeah, so, I mean, so what happened was the estimate is based on actual fiscal year 2022
Yes,
revenues from tobacco tax.
right,
And so with that, divided it by 16 cents per stick to figure out how many cigarettes were consumed in
Right.
fiscal 2022.
right,
Then an assumption had to be made. So we had the universe of this many cigarettes were
Right.
smoked in 2022. And then hanging out there is this subset of
right.
vapors that we don't know how big the market is.
So you know what? I have a time limit,
Okay, I'm sorry.
Director. So I'm gonna have to ask you to provide written testimony as to projections if you reverse engineer that subset. Okay?
We can do our best, yes.
Okay, thank you very much. Okay, any other questions? Okay, Senator Fukunaga, please proceed.
Could I ask that gentleman who's a retailer whether or not he has estimates of volume of sales and, you know, what percentages?
Quite surprised nobody asked the merchant who's in the front line of the business to actually answer some of these questions.
Yeah,
Well,
she did.
X, had to raise my hand for it. But so what percentage are you guys gonna tax if it's sold on the streets? So right now you have a lot of Chinese cigarettes in the Asian community that's not being bought here in Hawaii or in this country. You also have luggages full of cigarettes from states like Nevada coming in. So you're not gonna tax anything if it's being sold on the streets. So you can raise your taxes if you want, you can even ban cigarettes, but you're not gonna get any revenue. Sooner or later, all that revenue is gonna be gone because everybody's gonna go to the streets buying their cigarettes. So that's my question and answers to quite a few people who are,
Okay,
no.
so you were not gonna be able to tax. Okay,
So
okay, any other questions? Okay, can we move on to decision making?
Yeah.
Okay, so Chair's recommendation is to pass HB 2504 with amendments. We're not gonna raise tax on the cigarettes, but we're gonna broaden the base. We're gonna broaden the base by adding 2 cents per cigarette, electronic smoking devices and e-liquids on page 11 sub A. We're gonna delete sections B, C, and D, so as not to make any changes to the existing statute. We are gonna add a section E that will state that 1 cent per cigarette, electronic smoking devices and e-liquids, but no more than $500,000 to the Attorney General's Tobacco Enforcement Special Fund. And Senator Kim has changes.
Yes, so we're going to be amending the section 304A-2168, which is the Hawaii Cancer Research Special Fund. And in that, we're going to add on item 2 under that, all fees and charges and philanthropic donations and other monies received in conjunction with programs of the Cancer Research Center of Hawaii, adding at the bottom a D, beginning January 1, the University of Hawaii shall report semi-annually to the legislature on the monies in the Hawaii Cancer Research Special Fund, including deposits, expenditures, and other transactions. The report shall explain in detail all income and expenditures from the special fund. And finally, we're going to add in D, the early clinical trial program shall receive no monies from the Hawaii Cancer Research Special Fund, and annual reporting of the financial status of the early clinical trial program to the legislature shall begin on January 1, 2025.
Okay, we're gonna add a defect date of December 31, 2050 to hopefully get all more written testimony from the Director of Taxation as to the fiscal impact. We are cognizant of the trying times. That's why we are not increasing taxes. So we are hearing from the retail merchants, but we are trying to make more effective the taxes that have already been passed. So any comments, questions, concerns passed with amendments?
So how long is this gonna be, 2025? How long is this passage, how long this is gonna continue?
It's gonna continue on so long as people are smoking.
Oh.
Any other comments, questions, concerns? Seeing none, Vice Chair to vote for the vote. Chair votes aye.
Okay, House Bill 2504, House Draft 2, recommendation of the chairs to pass with amendments. Chair votes aye, Vice Chair votes aye. Senator Keokalole. Aye. Chair Shimbakuro.
Aye.
Sarah Wah. is excused. Recommendation is adopted.
Okay, same recommendation for the Committee on Higher Education, passed with amendments. Chair votes aye.
Chair votes aye. Vice Chair votes aye. Senator Fukunaga.
Aye.
Senator Hashimoto.
Aye.
Senator Favela. Measure is adopted, Madam Chair.
Okay, thank you very much. We're moving on to the 103 agenda for HB 2309 relating to homelessness. First up, Hawaii State Department of Health and Support. Only other one person testifying, registered to testify, Connie Mitchell, Institute of Human Services and Support. Please come on up. You have 1 minute.
Okay. Hi, I'm Angie Knight with IHS, standing in for Connie Mitchell. We stand on our written testimony. There is a great need for more of these homeless triage centers. We recommend that the name be reflecting more of the services to the Homeless Triage and Treatment Center to better differentiate the services that are available at these sites.
Okay, thank you very much. Okay, no one else having registered to testify. Those providing written testimony, SHIPTA in support, Partners in Care, Oahu Continuum of Care in support, Hawaii Substance Abuse Coalition in support, ACLU Hawai'i in support, Ellen Godby Carson in support. Anybody else wishing to testify on HB 2309? Members, any questions? Are we ready for decision making? We're gonna decide for HB 2309. Chair's recommendation is to pass with amendments. We are going to adopt Department of Health's proposed amendment. We are going to amend, we're gonna further amend to add on line 13 of section 1 after homelessness and those at risk of homelessness, that phrase. We're gonna remove from page 2, lines 3 to page 4, line 6 of section 1, because we want to take into account that it's not only IHS that's providing triage centers. Department of Health has EVA, County of Honolulu has other services, and so does the County of Hawaii. So we want to we want to ensure that people know that there are other people other than IHS providing triage services. And we're gonna add tech amendments. Any comments, questions, concerns? Seeing none, oh, and a different defect date of December 31, 2015. Any comments, questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye.
Okay, House Bill 2309, House Draft 1, recommendation of the chair is to pass with amendments. Chair and Vice Chair vote aye. Sarah Keokalole.
Aye.
Sarah Shimabukuro.
Aye.
Sarah Wa is excused. Recommendation is adopted, Chair.
Okay, so for the 105 agenda, first up, HB 2042 relating to mental health. We have registered is Hawaii State Department of Health on Zoom. Are you present? Okay, moving on.
Yeah, sorry, they're present on Zoom, Chair.
Okay, please proceed. You have 1 minute.
Hi, excuse me, Chair, Vice Chair, and committee members. I wanted to just highlight one of the proposed amendments, which adds a budget neutral Part 2 section to this bill that updates a 50-year-old statute defining the Child and Adolescent Mental Health Division. Otherwise, we stand on our written testimony.
Okay, thank you. Thank you very much. And next up, YMCA in support. YMCA, are you present?
Thank you. My name is Kyle Ishizaka. I'm with the YMCA of Honolulu. And I just want to say that HB 2042 transcends through the 3 priority, which are Maui wildfire recovery and relief, houselessness and affordable housing, and mental health priorities that the legislative body wants to address this session. I just want to also add that through the Maui Relief Fund, Hawaii has initiated and extended its mental health program to 3 schools on Maui. Yesterday, I met with the principal from Lahaina, and she shared how the trauma from the fires affected the youth and their families. Principal appreciated school starting October, and hearing laughter in the halls brought back a sense of normalcy. So I believe that mental health services to these youth will help to continue that normalcy for them. It can further assist teens on Maui and throughout the state, help youth cope with issues in becoming houseless in the future, and support youth with mental health concerns.
Okay, thank you very much. Next, we have Jill Corleone in support.
Hi, thank you. My name is Jill Corleone. I'm just going to add to my testimony. My daughter wrote testimony in support of HB 2042. She's participating in the YMCA program locally at her middle school, and the program has helped her better understand people She's learned how to see things from other people's point of view. This has helped her change how she talks to friends with school, at school. And she's just more open and sharing about herself and with her friends and her family.
Okay, thank you very much. Okay, no one else having registered to testify, those who have provided written testimony, Department of Human Services, Office of Youth Services in support, Office of Hawaiian Affairs in support, YMCA of Honolulu in Office of Hawaiian Affairs, come on up. You have 1 minute.
Aloha Chair, Vice Chair, Kili'i Nixon from the Office of Hawaiian Affairs. We will be sending on our written testimony in support. Mahalo for the opportunity. Sorry that we weren't able to let you folks know that we're going to do.
Okay, thank you very much. Okay, next we have Mental Health America of Hawaii providing written testimony in support, Hawaii Youth Services Network in support, Hawaii Substance Abuse Coalition in support, Democratic Party of Hawaii in support, Opportunity Youth Action Hawaii in support, Haley Hawking in support, Marsha He in support, Michael Older in support. Anybody else wishing to testify in HB 2042? Members, any questions? Seeing none, moving on. HB 2393. First up, relating to Title 24, Hawaii Revised Statutes. First up, DCCA in support.
Chair, Vice Chair, DCCA Interest Division, stand on written testimony in support of our administration. Glad to answer the question.
Thank you very much. Okay, nobody else having registered to testify. We have DCAB providing written testimony, in support, Martha Weidman, Dr. Weidman in support. Anybody else wishing to testify in HB 2393? Seeing none, members, any questions? Seeing none, we're ready for decision making. We got 4 minutes. Okay, so for HB 2042, Chair's recommendation is we're gonna just pass this as is, noting the defective date and noting in the committee report, DOH just proposed amendment, which is that it be subject to the procurement process, which goes really without saying. That's why we're not putting it into the amendment. Any comments, questions, concerns as is?
Okay, recommendation of the chairs to pass HB 2042 House Draft 1 as is. 4 members are present. Any reservations? Any no's? Recommendation is adopted, Chair.
Okay, thank you very much. Next, we have HB 2393. We're just gonna pass this by changing the effective date of July 1, 2025 pursuant to what was testified to by DCCA. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
Okay, 4 members are present. Any reservations? Any no's? Recommendation is adopted, Chair.
We are adjourned. Thank you folks very much.